Jennifer, I think I want to throw up I'm going to put up a slide that Jennifer created, especially for today's program, because we're doing a lot of thinking aloud. That's part of, we love it when WIHI is actually part of the development of how we can begin to dig in, and we wanted to theme this WIHI as figuring out points where we can dig in. So this is this slide, John, improvement science applicability. And Jen, just talk with us about it for a few minutes.
So this is you guys are going to have to bear with me and don't fall asleep. Yes, I'm showing data right after lunch here. So I think the item to the left is a run chart. So it's a run chart. If you're familiar with IHI, familiar with improvement, it's something that we use all the time. This is in the acute care setting. It's a defect that we're very aware of hospital-acquired VTE, and that is the pink line. So we're tracking, numbers of cases of VTE. And the bluish line or black line that appears on this screen is the prophylaxis, percent prophylaxis, the different pieces of the bundle, and the reliability or the compliance with the bundle. So you can see there's a very clear association between the cases of VTE on the decline as the reliability and compliance with the bundle. So just for fun and just for a way to kind of apply this to delayed diagnosis. Let me say the thing on the right, it's not real data. Please, it's not real data. I was so worried about that. And so this is my mock-up, and it's not really fancy here, but I'm just proposing that if you were to test 4 of those 6 test result processes that we talked about earlier, and yes, I always take it back to test results because it's the easiest one to think about, but if you were to take those items, and let's say most providers are probably hitting those 4 items at a 40% reliability or compliance rate, and you started to actually use improvement science to start to improve the reliability of those pieces of the bundle, then potentially we could take that gray line, which is the estimated value proposed by the IOM report, and then kind of bring it down to the blue line. So this is just purely my way of saying, could we use improvement science and really think about those pieces that are pieces that relate to reliability, compliance, to actually decrease this rate of diagnostic error. And I think, the panel has really, and all the folks that are chiming in here, there's not really good data. It's hard for us to really measure that gray line or the proposed blue line. And so the key is to kind of come together and think about what are these proxy measures. And as I mentioned before, maybe the proxy measure is the reliability. It's that percent of compliance with these pieces that we know can unlock or mitigate these events that are happening. So it's just kind of a silly way of saying, can we use improvement science here to help frontline providers?
Thank you, Jennifer. I really appreciate something that we can ponder, and it's great that you turned this into a visual.